All right, guys, welcome back to the podcast. We have a very special guest today by request. We have Annie Du, our Injector nurse that works for us. She's amazing. She's awesome. So I have to tell you, there's not one week that goes by that there's not one client that tells me, should I get Botox or fillers? Always, always, always. So I was like, okay, let's get Annie on the podcast so we can actually discuss all the things, because I know there's a lot to talk about when we talk about injectables. It shouldn't be taken too lightly, you know? So let's talk about your background first so people can know, what you did, where you're coming from, and all of that.
Sounds good. Hi, everyone. I'm Annie. I've been a registered nurse since 2013. That's when I graduated from the University of Ottawa. My main background is currently in emergency medicine. So I have 10 years of nursing experience. Initially 6 years in inpatient acute care medicine at the Ottawa Hospital, at the Civic specifically. I've been there for 10 years. Wow. And then the last almost, I want to say 3 years now, I've been in emergency medicine. I started doing cosmetic injectables in 2018 is when I got my training, and then there was that whole COVID thing. So
we know that one.
Really got into it in 2019, 2020. And I've been with you guys since
the beginning. Yeah,
since the beginning, exactly.
Yeah.
So I still work in emergency medicine, and I actually have three different types of nursing, all registered nursing. So emergency medicine. I also work for a cosmetic eye surgeon who does ocular plastics. So like upper lid blepharoplasties, lower lid blepharoplasties. It's like the extra skin removal. I do circulating recovery nursing for him. So that's more like OR nursing. And then I do the injectables, which is my own business. And that's cosmetic nursing. And that's under a medical director. So I have a medical director, either a physician or a nurse practitioner. Currently, it's a nurse practitioner, but I've had a physician in the past who signs off on my orders.
Yes, because you need that.
Yes.
You can't just order all the Botox and just...
Yeah, it's super important.
Super important.
I don't think a lot of people understand, the legalities behind it, because it is cosmetic injectables is a super, almost gray area when it comes to registered nurses doing the injections, because you can have registered practical nurses doing the injections as well, but what you need to make sure is that they're professionally responsible and they're actually getting their orders signed off by someone who is legally allowed to sign off on these orders.
Exactly. And plus, aren't you taking your course, or your, I don't know what you call it, but
I would love, yes, my goal,
Yes.
my long-term goal is to do my NP as well, to get my nurse practitioner, so then I can just be a medical director and do this, this business practice that I have independently.
Yes, because you don't need to go through another person to order your stuff and to,
yeah. However, I do love my medical director. She's fantastic.
Yeah, she's great. Yeah, no, she's awesome. So let's talk about neuromodulators first. So that's Botox, guys. So why don't we just go deep dive in the neuromodulators, what it does, how long can it last, all the stuff.
Perfect. So this is pretty much like going through informed consent, what you should always be getting done when you're going to get injectables from any practitioner. I think a lot of the time when you go to a physician, you get assumed consent because you're going for something elective. So they just assume you're coming here so you know what you're getting yourself into. So we're just going to go ahead and go for it. Usually when you come to see me, I spend a good 15 minutes going over informed consent, and especially our first treatment, because every consecutive treatment is going to be similar. It's going to be the same things, and we only go over the main side effects of the areas that we're going to be treating. Yeah. So neuromodulators is the general kind of drug name for the brand names of Botox, Dysport, Xeomin. These are the ones that are available in North America, Canada specifically. There are so many other ones available in Asia and all that stuff. I don't know them. I only know the ones that I do. Personally, I prefer Botox and Dysport. Those are the two that I carry. For ease of speaking about it, we'll talk about neuromodulators, so that we're not only talking about brands, we're actually talking about the umbrella term of what it encompasses. I think we should go over, for sure, what people think when they're getting neuromodulators. They think they're going to start to look plastic.
Yeah, yes.
But that's not what neuromodulators do.
No.
Neuromodulators are actually a neuroleptic agent. So what that means is that it actually paralyzes the muscle, depending on which one we're injecting. So you don't actually see the effects right away. It takes about 3 to 4 days before you start to see or feel the effects. And when people say, oh, what do you mean by feel the effects? It's like when you're going to raise your eyebrows, if we're doing your forehead or frontalis is that area, you'll start to be like, oh, I can't really lift my eyebrows as much. However, it's not right away. It's 3 to 4 days before you start to see or feel the effects, 2 weeks for maximum effect. Yeah. And I can never, I can't predict what it's going to be for each person. Everyone is different. I've had somebody have 26 hours and it's in effect.
Wow.
Yeah.
Okay.
I didn't believe her, and she sent me a video and she was like, Annie,
Frozen.
I swear it's in effect. I'm like, impossible. I've never had anyone in 24 hours have it be effective, and lo and behold, it was. And I've also had the other end of the spectrum where day 13, she's messaging me and she's my face is still really moving, and I'm like, okay, we have one more day.
Yes. Let that day go.
So here I am freaking out a little bit too, but I'm like, okay, trust the process. It's
Exactly.
2 weeks. And then literally she woke up and she's like, Annie, I'm frozen. I'm like, okay, perfect.
Perfect. Yep. Trust the process.
So again, 3 to 4 days before you start to see or feel the effects, 2 weeks for maximum effect. So it's always important, especially if it's your first time getting injections, to actually come and see me at the 2-week mark.
Yeah.
Because the way that I do it is my model is start low, go slow. Because I can always freeze you a little bit more than take away the freezing. I can't take away the freezing.
No.
The good thing about that, though, is neuromodulators isn't something that lasts forever. It's effective for about 3 to 4 months. So even if you do get some of the side effects we will be discussing, they're not forever.
No.
So the nice thing is if you hate it, which is like a very low,
It's a low percentage
of people who hate it, you just never come back and your face goes back to normal.
That's
it's
it.
as simple as that.
Yeah.
So this is the best part about neuromodulators. You're like, I'm going to try it out. I'm kind of scared. That's okay. If you didn't like the effects, you don't have to get those areas ever again.
Nope.
Maybe we tweak it a little bit, go a little less.
Yeah.
Just because the goal of the treatment is to decrease the muscle capacity, so the muscle contractility, anywhere from 80 to 90% reduction.
Yeah.
I think in Hollywood, we see a lot of people who are like 100% reduction. And so when they're like, I don't want to look plastic, that's a combination of fillers, which we will talk about later.
Yes.
And neuromodulators, because now you can't contract your face at all.
Yeah.
That's 100% reduction. And then you're augmenting, so you're changing the way your face looks by filling it up with hyaluronic acid. So it's a combination of the two.
We'll go over that later.
Yeah, later.
What do you say to, because you talked about this the other day, I thought that was very interesting, but you know how people say like, oh, it's a toxin, and I don't want that toxin in my body. What do you answer to that? Like, what's your professional answer?
I do explain the drug,
Yeah.
right? The whole point of informed consent is that people don't want the toxins in their body, but like we drink toxins every day in our
We do.
water. We have fluorinated water, but that fluorine is good for our teeth, but it's not actually good for our bones. So it's a decision that you have to make on your own. It is a toxin. It's a neuromodulator. So it's botulinum toxin A. If you actually go all the way back to why children can't have honey below the ages of 2, it's because of botulism.
Really?
Yeah.
I didn't know that.
That's why infants can't have honey until it's like two or above.
Really?
Because of botulism. So it's the same kind of toxin that causes that paralysis. But what we're so the drug formulation itself specifically, you're getting like 1 unit. People are like, what's 1 unit? So you have 1 milliliters, which most people will know 1 milliliters. 1 unit is 0.01 of that milliliter.
Oh my God. It's tiny.
So in 1 milliliter, there are 100 units.
Oh.
In 1 milliliter. So split up 1 milliliter into little tiny units.
God.
In order for neuromodulators to be toxic, have a toxic effect on your body, you actually need 3,000 units in your bloodstream.
Okay.
On average, if we're only doing like the upper forehead or just like the upper face area, you're doing anything from 15 units to like maybe 75.
Like,
So 3,000
3,000.
units in your bloodstream is what's toxic for you.
okay,
Yeah.
so it's safe.
Yes, it's very safe.
And wasn't it used like for like a very long time before it went into the cosmetic industry? Like, wasn't it used for incontinence before?
I feel like, I don't know about the incontinence. I feel like that's actually a newer use, but it was actually used for more neuroleptic diseases. So you
Oh.
have people with like Bell's palsy. So the perfect
Yes.
example as Canadians is Jean Chrétien.
Oh, yeah,
Jean
yeah.
Chrétien had a Bell's palsy. So you're using Botox or neuromodulators
Yeah.
to treat the opposite side of the face that's going to be contracting and having all this wrinkle production. So one side of his face is always so smooth, right?
Yeah.
Because he couldn't move it. He had a palsy. He was unable to move it. So these neuroleptic agents were actually initially developed for neurological diseases, cerebral palsy, Bell's palsy, like palsies in the muscles, right? So think about anything that's super contracted, especially the cerebral palsy. Sometimes you're toxing certain muscles to allow it to relax.
Wow.
Yeah.
I didn't know that. That's awesome.
Yeah, so
Okay.
that's why I think a lot more newer cosmetic procedures, they're doing like trap Botox or
Oh,
neuromodulators now to kind of relax the
that's it.
trapezius muscles if you're super tight there. But that's also like medical use. Like you have TMJ syndrome.
Yes.
So people will tox either their temporal area, their masseters, the back of their necks. Chronic headaches are also relieved for
Migraines.
that, migraines. And that all depends on where you're placing the injectable. Yeah, because what you're doing is you're just relaxing the muscle that's super, super tight.
Okay. So, for a client that's like scared of getting, and that happens all the time, right? It's like their first time and they're like, oh my God, I don't want to look fake. I don't want to look plastic. This is typically what you would explain to them in order to like calm them down.
Yeah, yeah. And it really helps that I start low, go slow.
Oh, yes. Yes.
And so there are some people who I do explain to them. Some people are like, well, I don't want like an 80 to 90% reduction. I can tweak it so that we're only getting 50% reduction the first time we're doing it. However, they have to understand that the effects of these drugs last anywhere from 3 to 4 months when we're getting the 80 to 90% reduction.
Right.
If I'm only reducing your muscle to 50% capacity, you're going to have that muscle capacity come back much quicker.
Quicker, yeah.
So you're only seeing like maybe 1.5, 2 months of efficacy versus the 3 to 4 months. And they're okay with that, especially if they're getting the injectables for the first time.
Yeah. And I mean, we all have our own choices.
Exactly.
So it's fine. It's a solution for everyone.
Exactly. And you go a little higher next time and they're like, oh, I've gotten used to it. And
I want a little bit more.
Yeah, exactly.
Yeah, that's neuromodulators, they work on you. I guess we'll talk about this after the question that I have, but let's touch on fillers first because a lot of people confuse them. They're like, "Oh, my friend got Botox in her lips." I'm like, "That's not Botox, except if it's the lip flip, but clearly it's injectables with fillers." So let's go with the fillers and explain, one-on-one on fillers.
Yeah, so like I said earlier, the difference between neuromodulators and fillers is neuromodulators just decreases the capacity of the muscle to contract. So you shouldn't look fake. You're just unable to contract those muscles and move your face. And you're only placing it in certain areas. Like you're not touching anywhere near your cheeks or anything that's affecting your smile because you need to contract those muscles to smile. Fillers is hyaluronic acid. So it is an acid. Everyone knows hyaluronic acid. It's the good stuff that goes into skincare. It's also naturally occurring in our skin.
It is,
right?
yeah.
And so fillers, if you are doing anatomical, scientifically placed fillers properly, you're augmenting. So when you're getting lip filler, that's when you're augmenting your lips. You're either getting more volume, depending on placement. You can get more height on your lips. So it can go anywhere vertically or out more as well. But fillers is anywhere you can get them in your deep cheeks. You can get them in your forehead, your glabella area, which is where your 11s are. Those are really high risk areas though. And then you can also get like all your lines. So like your nasolabial folds, your marionette lines, your chin, your jawline filler. You can even get filler in your neck. Yeah, you can get filler in your hands as well. But that's because you're filling in space that has, over time while you age, has depleted. And a lot of people, they don't want to look fake, but I think it's because you need to be cognizant of where you're placing your filler. When you get older, people think that they're sagging. It is a combination of like losing your elastin and your collagen, but also losing that deep fat tissue that anchors all your muscle to your bone. So it's not just your skin quality. It's actually the deep fat pockets that are underneath.
Yeah.
So you have 2 different fat pockets that are actually in the layer of your skin, and then one nice deep one that sits in between the bone and the muscle, and that's what anchors everything. That's what makes you look youthful. That's what makes you look plump. So when you're talking about like filling your lips, it's a nice little tubular kind of it's like a little it's like a nice little tubular case.
Yes.
It's all there, and that's why you've got different color, like your lips are a different color from your skin.
Yes.
It is different. But then when you're doing deeper injectable treatments for your fat, you're going all the way down to bone. I know that sounds scary, but it's actually a lot safer because all of your vascularization is in the upper layer of fat. It's not in that deeper layer of fat. It's all in your muscles and that upper layer of fat. That's where all the vascularization is, and that's why it's pretty high risk to inject your lips because your lips are highly vascularized, right? And you have that, it comes up through where your marionette lines are, your facial arteries and stuff like that actually supply your lips. But these deeper spaces are a lot safer to inject. There are obviously risks still associated with it. But in order to not look fake and you want to look rejuvenated, which is most of my clientele, actually, I will say, there are other injectors that do lovely jobs in terms of like augmenting people to, everyone wants to look like a Hollywood star nowadays.
Yeah.
But that's just not my demographic. My demographic is all like, they want to look rejuvenated, they want to look natural, they just want to look like themselves still.
Yes.
And so that's my clientele.
Yes.
So it's all about like you, again, starting, go slow, start
low, go slow. Yes.
And we go from there. However, a lot of the facial rejuvenation stuff that I do, which I absolutely love, is like deep cheek, jaw, deep nasolabial folds. I'm pretty much replenishing the deep fat layers that you've lost that is causing all of the muscles to not be anchored into the bone like you would like it to.
That's nice to put it as an anchor.
Yeah, it's an anchor.
It makes sense. Yeah, it makes more sense that way.
Yeah, because lips, it's not anchored to anything.
No.
And you do lose your fat volume as well, but that's not like a deep bony fat. You don't have deep bony fat in your lips. It's the subcutaneous layer that's actually within the skin.
Okay.
So you are trying to inject into that area there, and that's where you get the augmentation. And depending on your technique, a lot of people, when they ask for volume, it's not just one technique that you're using. It's a combination of techniques for adding vertical height to make your lips look also like wider versus just coming out and looking puffier. So it's like that little ducky look,
like the duck face. Yeah.
It's not a great look, but it's and you can fix it. And you have to be really careful with lips too, right? Because just kind of like a good example is like when you overstretch your skin.
Yes.
There's time of when to stop.
I was going to say, that was one of my questions. Like, what's your take on young people that like, hey, I want to be like Kim Kardashian. I'm going to fill myself up. And their lips are huge. And it's like, what is that going to look like when you're older?
So it's not going to look great.
Yeah.
It is. You can't really have that skin bounce back because you've already overstretched. It's
because
like,
it's a space, right?
It's a space.
Okay.
Exactly.
Yeah.
It's a cavity. It's like a little tubular cavity that you're injecting.
That's staying there.
Exactly. So I think it's actually the professional responsibility of your injector to tell them when it's too much.
Too much. Yeah.
And I'm one of those people.
Yes. Yes, you are. That's why we love you.
I am one of those people that are like, oh, you might want to think about this. Like, I'll top you up, but this is enough. And I do have some clients where I'm like, oh, okay, like I am going to top you up because your lips do look really good right now. And I understand it's been 6 months since your last procedure. Oh, and that's the thing about hyaluronic acid. It lasts anywhere from 18 months to 24 months. So 18 months to 2 years.
Yeah, that's great.
Depending on the product, right? And so once you build a foundation on these products, right, you're building a foundation. It's already there.
It's there.
By 6 months, that's when it's okay to be like, okay, maybe we should replenish you because your body has started to metabolize the product. And if you want it to look exactly the same as you did when you had like, you build your way up. I don't do more than 1 ml of filler to your lips each session.
Right.
But at that point, you're like, oh, I only need half. I'm like, oh, well, actually, you only do need half to keep the current look, that like your desired look.
It's like a top off.
Exactly. It's like a little top up versus people who are like, I need a full mil. I'm like, oh, you don't actually need a full mil. Your lips are big enough.
Yeah.
And it's quite interesting now, like the more recent updated courses that I've been doing, they actually talk about body dysmorphia.
Oh, they do?
They do, and I think it's a beautiful thing to discuss how you're seeing yourself. I cannot fix that with filler and neuromodulators. This is something internally that you have to work on, and so it's a discussion to have with these clients to be like, everyone's got a bit of body dysmorphia, but I can no longer inject your lips to have them come up to the size where we can't like pull back from that kind of thing. Like I'm going to
damage
you, right? Like I will dissolve your lips, and at some point, it's like even if you don't want lip fillers, you're gonna have these little these little extra skin
hanging off.
Exactly, where you are gonna have to have lip filler always because you just don't have any of the hyaluronic acid in there. So it's a discussion of, and I have had those uncomfortable discussions, but that's the difference between like having 10 years of nursing experience in acute care medicine.
Yes.
Right.
Yeah.
I'm comfortable having those conversations,
and you have to,
and you do. You do have
Can't
to.
just please.
Exactly.
Because otherwise it'll backfire on you.
Exactly.
Yeah, no. It's like the other day you were saying, I don't want someone to walk around with these kind of lips and saying, Annie, you did these lips.
Never.
Never. So that's fillers. And then we're talking about like the gap and everything. And I want to touch on the permanent fat dissolving thing. So my take is that I tell people, well, kind of like the lip fillers, it's like you're dissolving that fat layer permanently. It's permanent, right?
Are we talking about deoxycholic acid?
I think
like
yes.
we're talking about like the double chin
Like
dissolving.
the double chin, or I think it's probably similar to like the cold sculpting or like the
Yes.
it's similar. Again, what is it going to look like when you're 60 and your skin has like no fat pad to stand on? Like, what's your take on that? Is it similar than having that lip filler that's too large, or
No.
okay,
It
go.
is not similar because deoxycholic acid is actually meant to dissolve a certain type of fat.
Type of fat.
So you
Okay.
have brown fat and I think it's like yellow or white fat. It
The
only
brown
dissolves,
fats are good, right?
I don't remember which fats are good, to be very honest with you, because I know it in LDL and HDL.
Okay, okay. I
know-
think brown fat is completely different. I don't think it's part of those.
Yeah. So, and that's why
Don't
I'm
quote
like-
us, please. Yeah.
That's what I don't know.
Yes.
But I know, I'm trying to remember, because I don't actually like to do deoxycholic acid
Okay, yeah.
injections anymore.
Ah, there you go.
Like
yeah.
I personally have done it
Yes.
like myself.
Yeah, I remember. Yeah.
And the thing is, just for like cost of treatment and how many sessions that you have to get,
It's intensive, right?
it is intense. I will say, only because deoxycholic acid, if we're looking at price point, for getting a chemical fat dissolvent versus just getting like a physical one like liposuction,
Oh, yes.
it
yeah.
ends up being about the same cost but less downtime.
Oh, so you might as well get the liposuction.
Exactly.
Okay,
And
yeah.
so my thing is like, oh, I could be making all this money off of you, but it's for me, like ethically and morally, I would just never
Just
do
not.
that.
Yeah.
Because the treatment itself is like anywhere from 1,000 to 1,200 per session.
Oh, God, yeah.
And you need at least 3 sessions for it to maybe get rid of all your double chin.
Oh, wow.
I've got an outstanding double chin that is a great example of
Yeah.
it. However, you get those injections there. The downtime is about 4 weeks, and you're actually like twice the amount, at least one
Yeah,
and a
you
half
swell.
times the amount of
You swell.
swelling. And that swelling is because the deoxycholic acids is actually interfering with the fat. Like it's actually like that's
Oh.
why you're swollen.
Okay.
That's how you know it's working. If you get it injected and you're more swollen, it means the deoxycholic acid is working on the fat to dissolve
cooking.
it. Exactly. It's like dissolving
Oh,
it,
wow.
and then your body's immune response takes up those broken down fat cells.
Oh, wow. Okay.
And the thing is, the idea is it's not guaranteed to work. Nobody
No.
likes that word. Let's spend $3,000 on at least 3 treatments.
Yep.
Sometimes you need 5.
oh, wow.
Sometimes you need 6. And it's not guaranteed to dissolve that fat because it only dissolves one type of fat.
Okay.
Whereas liposuction under the neck is like $3,000. And then the downtime is maybe 2 weeks.
And don't they tuck it back too?
I don't know. I've never had a consult. But I
Because like
do
you
know
would
it's
think,
$3,000.
like you would, you're like, I'm excited. But I figured like if you're doing the fat dissolving stuff and then you get older and then like you start to have like, because the skin's still there, right? But it's just like it's starting to, because
Yeah.
there's nothing else underneath. So I figured, well, you need a tuck too at the same time to make it like nice and tight. So I wasn't sure if that was part of the deoxycholic.
Deoxycholic acid, yeah.
Deoxycholic acid, yeah. So it's a type of fat that it dissolves.
Exactly.
Okay.
It doesn't dissolve all
Every-
types of fat, right?
okay, that
so
makes
like
sense.
I might have this brown fat, but underneath it maybe there's this like yellow or white fat layer that I can't dissolve.
That you can't. Okay.
Exactly. And that's the guaranteed. Whereas for $3,000 for the same price of getting 3 sessions of deoxycholic, you can get liposuction. And that liposuction under the neck, I don't know, like you'd have to get a consult with
For
a
sure.
surgeon, all that stuff. But when you're looking at guaranteed results, like
You'll have a better-
guaranteed,
yeah.
And the downtime isn't 4 weeks per session of the
It's-
injectables.
It's like total.
Yeah, so you're getting like maybe 6 months of
Yeah.
treatment for the injectables. So you have 6 months of like this,
This huge.
like you look like a bullfrog.
Oh, wow.
You actually look like a bullfrog.
Okay.
And so then you're like, you can't go to meetings or you don't want to.
You can't hide that.
Exactly.
Yeah.
You've got conferences that you need to go to. Like, I don't know what people do, right?
They put a turtleneck on.
Exactly. But that turtleneck only hides your neck, not
That's
that like
true.
that like
Or you put a mask
bullfrog.
on. You put a mask on
Yeah.
and just hide that.
It was really good during COVID
Yeah.
though.
Yeah.
If you wanted to get it done, because you always had a mask on, so it would kind of hide it. But my thing is, I just advocate for getting liposuction.
Yeah. Well, it's honesty too.
Exactly.
Like, you
I'm like,
might
it's
as
for
well.
the same price. You can get 2 weeks of a bit of bruising and downtime versus like 6 months, because every 4 weeks you're coming to see me to get more deoxycholic acid into your double chin or
Yeah.
neck area, the submental fat, as they call it, to dissolve it.
Wow, I didn't know that. So that's great.
It's honestly why I haven't done it. Like, I did the training.
You did it, yeah.
I did like 3 clients.
And then you were like, nope.
No, and it just wasn't for me. And that's the thing. Like, it's learning,
Yes.
actually physically doing it, and I did it on myself too. I
Yeah.
didn't like the downtime.
God.
Yeah. And so I was like, it's just not worth it. Like,
No.
and there are people, I get it, that are afraid of going like
Under.
under the knife, but liposuction isn't a knife.
It's not. It's like a thing that goes in and sucks.
It's like a gigantic metal straw.
Yeah. It vacuums all the fat.
Exactly.
Yep.
It sounds pretty aggressive, but
It
when
looks aggressive too when you look
Yes.
at videos, but you're under, so
yeah, like, don't look at the video.
just don't look at the videos. So, contraindications
Ooh,
for either.
contraindications.
Yeah.
Okay, perfect. So we'll go over neuromodulators.
Yes.
And then we'll go over hyaluronic acid.
Okay, cool.
So I like to go over actual side effects for neuromodulators, because I think a lot of the time side effects aren't talked about. People
No.
always think like, oh, okay,
A little headache.
it's a neuroleptic.
Yeah.
I'm just going to decrease the contractility of the muscle between 80 and 90%. Yes, that's fantastic. But here's the thing. Each area has its own not adverse, but like side effects that can occur that you don't want. Unwanted side effects.
Yes.
So in between the eyebrows is called the glabella area. It's actually 3 muscles that make up that area. The procerus and then the 2 corrugators on either side.
Yep.
The most unwanted side effect for that area is ptosis, so a droopy
Oh,
eyelid.
a droopy eyelid.
A droopy
Yeah.
eyelid, or double vision. And that happens in 2% of all injections.
Wow.
Somehow the neuromodulator just drains into the muscles controlling the eye, and that's what gives you the ptosis, the droopy eyelid, and diplopia, the double vision. And again,
Double vision? I
yes.
can't even imagine.
there is an eye drop that I can give
Yeah.
people to get rid of either of them.
Okay.
However, the side effects of those eye drops are that it is a glaucoma med, so it increases the pressure in your eye and
Oh,
can cause blurred vision.
Oh, great. Okay. So blurred vision or double vision,
Yeah.
have your pick.
Exactly.
Okay.
But again, those aren't forever, right?
No.
3 to 4 months later, it goes away.
And it's probably like it peaks and then it slowly decreases. So,
Exactly.
yeah.
Exactly,
Okay.
because the more you use that muscle,
You move, yeah.
the more you're going to metabolize
The product.
the product in that area.
Okay.
So that's for the glabella region. In your frontalis, which is your forehead area, you can have unwanted like heaviness.
Right. Like a
Yeah,
sticks.
the best example is just putting your hand on your forehead and then trying to raise your eyebrows.
Yep.
Sometimes it feels a little bit heavy. Some people do have something we call a functional frontalis.
Yes.
Those are people who sometimes have maybe like a little bit of a hooded lid, and they don't realize that they actually walk around with their eyebrows raised all the time because they're trying to open their eyes up a little bit more.
So that's a no-no.
Those are people that I would say it's contraindicated for treatment.
Right.
Sometimes if their lines really bother them, we can move the injections up just to like the really upper forehead area to see if that helps.
Okay.
But again, I warned them. I'm like, you know what? Like, I can tell just from talking to you, you walked into the room with your eyebrows raised. You don't realize that you're opening your eyes right now with your frontalis muscles.
Yeah.
So I would say it's contraindicated for people who have a functional frontalis.
Gotcha. Yeah.
And, you know, I have had a few clients who still want to try it, and they do, and they're like, you know what? I did feel heavy. And, you know, these are clients that still see me to this day.
Oh, of course. You were honest.
Exactly. And they were like, you know what? You did tell me it was going to do that. I'm just not going to do that anymore. Perfect.
Perfect.
And we just don't do
Off
it
the
again.
box. Yep.
And this is the thing, like a very good example of these clients still see me is that their faces went back to normal.
Yes. Yes.
They went
it's
back
not
down.
permanent.
Yes, they went back to their baseline.
Yeah.
Crow's feet, the orbicularis oculi area. Sometimes you can get a chemical eyebrow lift. Some people have asymmetrical eyebrows.
Right. Yeah.
One sits a little bit lower than the other. We can do unilateral, so one-sided eyebrow lifts. But the side effect of having any orbicularis oculi injections is if you inject just a little too high, it can cause an eyebrow droop.
Oh, no.
And it's just what it is,
Yeah.
right?
Okay.
So you can get an eyebrow lift and then any of the crow's feet injection as well.
Okay.
That's just when you smile.
Yeah.
Some people do have the lines that like go into their cheeks, and you can get that treated a little bit closer to the eye. However, you have to be careful, right? Because you don't want to get into like your cheek muscles.
No. Yeah.
Right?
Because you're.
And you do like I think they like to call it like baby Botox in
Oh,
that area
yeah,
now.
I've heard
It's like
that
a
before.
newer, like just like smaller, tiny amounts to try to decrease it. But I find if you just do the lateral sides of your face there, it really helps make you look a little more youthful.
Yeah. refreshed.
Yeah, you just look refreshed. You look like you're getting some more sleep. And that's my favorite compliment. When people come back
Yeah.
and they're like, people are asking me what I did to my face. And I'm just telling them I changed my skincare. I'm like, perfect.
Perfect.
That's fantastic. If you can lie about it, lie about
Lie
it.
about it. You have other people that are like, I got Botox, man. Like,
yeah.
you know, it's fine.
Exactly.
Okay.
And then that's upper face.
Yeah.
Surprisingly, you can also get neuromodulators for your lower face.
Yeah, well, the smile, right? Smile line?
So you can get what people do get, as they call Botox, around their lips, and that's what everyone's calling nowadays a lip flip.
A lip flip.
That area is actually the orbicularis oris. That's the mouth. The only thing with injectable like neuromodulators around that muscle is that you're decreasing the contractility of that muscle. So you're going to have a little bit of trouble pronouncing words sometimes. So I don't recommend it for people who do have a stage presence. So if they do comedy, if they're actors, if they're singers and they really need to enunciate their words,
Yeah.
I don't recommend it. You do have a bit of difficulty drinking from a straw for a little bit.
Yep.
And like pursing your lips and smoking cigarettes. But initially, before it was called the lip flip, it was actually the smoker's lines treatment.
Oh, it
right?
was.
Because people who smoke cigarettes are always pursing their lips.
Right.
So, and that's what you're treating.
Okay.
The only thing is, because your mouth, you're always using it to talk, to smile, you actually metabolize the neuromodulator in that area much quicker. So I find the effects are only about a month and a half.
Oh, wow.
Maybe
Okay.
2 months.
Short, yeah.
Yeah, it's very short.
yeah.
Right. But some people will still get it, and there's like no middle ground. You either hate it
Or you love it.
or you love it.
Oh, God.
There's no like, maybe. Like,
I'm okay.
yeah.
Well,
So lower facial weakness and difficulty pronouncing your words for the lips. You can get something called your DAOs,
Yes.
dorsalis anguli oris. DAOs, yes. Dorsalis anguli. I just call it DAOs all the time.
DAOs, yeah, that's what I hear all the time, yeah.
And that's the one I can't frown for you guys right now because I get that treated. The best is when I'm like making all these faces and people are like, I'm like, frown for me. And they're like, what are you doing? You're squinting your eyes. I'm like, frown for me.
Frown.
I'm sorry, my Botox is in effect.
Yes.
So you actually, the one that makes your lips turn down, like an
yes.
actual sad face. So I actually, story time recently, because I hadn't treated mine for I think about 8 months, my DAOs, I was like, oh, let's just do it every other time. I went to treat it this time, and I had that unwanted facial weakness, that lower facial weakness.
Oh, no.
And that's because I didn't realize that when I smile, my DAOs would also take effect. And that's why my smile wasn't like very upturned. It was almost like straight across.
Just straight, like this.
Straight across, because this would also pull.
Right.
And so then I had some difficulty speaking because I guess when you say cheese, it's cheese. But for me, I was going cheese.
Cheese.
And so I was actually having difficulty pronouncing any of those E words. I'm used to it now, obviously. But for the first, I found month, it took some time to get used to. It was,
That's a long time.
yeah, well, it was 2 weeks of me being like, I feel like I'm slurring my words. Something's really happening here. And then 2 weeks of like, relearning and like changing the way my facial muscles work to speak. So story time, that was me. And so
Tips.
exactly. And so it does happen, the lower facial weakness. My favorite treatment that I also get is my masseters.
Oh, yeah, right here.
So that's that muscle that's right around the, like pretty much the edge of your jaw right there. That is what you use to masticate, to chew, thus your masseters. So people who clench a lot at night or just clench a lot at baseline, you can get that toxed and that'll help decrease the clenching. People
Does
are-
it slim you to, like...
It does. So the nice cosmetic effect of having your masseters done is that the byproduct is the facial slimming, because some people have the very like square jaws, and that's sometimes because they just have gigantic masseter muscles. So you treat that, and even if it atrophies your muscle, which is like to break down your muscle, 50%, you're getting 50% facial slimming. Now, you don't see the effects of the facial slimming for about 4 weeks.
Yeah, makes
because you
sense.
actually need to wait for the muscles to atrophy. However, you do feel the effects within 2 weeks.
Oh, wow.
You're like, I'm not able to clench as much anymore.
Can you eat? Like,
You can eat.
Okay.
You're never toxing it to
Okay.
the point where you
Can't
can't
move.
masticate.
Okay. Thank God.
and honestly, you work your way up. Like I usually
Yeah.
start my clients anywhere from like 30 to 40 per masseter
Per
muscle. 'Cause
masseter.
It's a bigger
It's a strong
muscle.
muscle.
It's a bigger muscle too. It's
Okay.
not like all the facial muscles
No.
that we're using right now. They're much smaller muscles
Okay.
that we're toxing.
Okay.
This one's a much larger muscle. I'm already up to 90 units per muscle. That's how big mine
Wow.
are. Yeah,
Okay.
and that's
Well-
why I was like, I can still chew.
Okay, you're good.
I can still chew.
Wow.
And then your mentalis is another area.
Right here.
The peau d'orange.
Oh, yes.
The little
Well, yeah.
dimply chin.
The dimply chin.
Yeah, you can do that too. And I think the best way to think about where you should get treated, look at your parents.
Yeah.
We age very genetically. Look at your parents. How do they wrinkle?
Yeah.
If you're like, oh God, I don't want to get those wrinkles, you might want to think about
Preventative
treatment.
Yeah, exactly.
And that's why people look at us and like, Emily and I are like, you guys are so young. Like, why are you guys getting treatment? Well,
it's preventative.
It's preventative. Like,
Yeah.
do you want to have a healthy diet and exercise so that you can prevent diabetes and hypertension? Or do you want to get hypertension and diabetes and then treat it? And why can't we look at aging as the same thing? We're aging gracefully.
Absolutely. Yeah.
And that's what it is. Like, I want to look 30 forever.
Yeah.
Or for as long as I can, right?
Yes, exactly. No, that makes total sense.
And so those are the side effects for those areas
Yes.
specifically. Other common side effects, obviously at the point of injection, discomfort, redness, and swelling. And then if you do get any bruising, the bruise can last up to 2 weeks. Takes about 2 weeks for a bruise to reabsorb.
Yeah.
Other side effects that aren't as common that I personally have not seen
Ever?
yet,
Yeah.
ever. Even the continuing education that I do, they've never seen it.
Oh, okay.
Are allergic reactions.
Right. I've never seen
Never
that.
seen them. I don't have a single instructor who's ever seen one either.
Wow.
But you can get things like a systemic spread that can cause difficulty breathing,
Oh,
muscle
boy.
weakness, chest tightness, nausea, and that's emergency management.
Oh, yeah.
And again, that's emergency management until the drug has, like, the effects have worn off, which is anywhere
Wow.
from 3 to 4 months.
Oh, God.
Yeah,
Okay.
unfortunately. But again,
Never seen it.
Yeah, and the first course I ever took, I think she's been teaching for like 20 to 30 years. She's
Wow,
never,
yeah.
and she's been injecting for that long.
Wow.
She's never seen it. And that's the thing, like, you don't know if you're allergic to something until you try it.
You try it. That's
Exactly.
true. That's true.
Very low risk.
Okay.
Yeah.
Because we're neuromodulators right now. Because you can't exercise. Like, what are the
yes.
post-care?
Post-care. So 24 hours, no excessive hot, cold, like hot tubs, saunas. I don't recommend any like microdermabrasions.
No. What would be cold?
Or like ice packs.
Oh,
like just
okay.
like putting an
Okay.
ice pack on
Gotcha.
the area.
Okay.
And then no exercise.
Yes.
Yeah, we're just kind of decrease that excessive sweating, right?
Yep.
And then 3 to 4 hours, you should remain upright.
Yep.
So no taking a nap post-injection immediately. And, I've had my own medical director. She was like, oh, Annie, I went and took a nap. I gave myself ptosis. So that
Common
one's
lingo.
important.
That's
Common
so
lingo.
funny.
Yeah, she took a nap and then she gave herself a little,
Oof.
actually, was it a nap? It may have been, she applied
Something.
sunscreen or makeup to the area.
No way.
Anyways,
Wow.
it was 3 hours. Don't be horizontal. So
Yeah.
3 hours remain upright, or 4 hours remain upright, and then 6 hours you're not going to heavily manipulate any of the areas that I've injected or cover it up with any makeup. And that's really just to decrease your chances of infection.
Yeah.
And like not to move the drug around because it was very pinpoint injection. Like I'm precisely placing these drugs in the areas that I want it to take effect in. So you're not going to rub it around and have it permeate other areas of your face.
Yes, that makes total sense. So it's not too bad.
It's not too bad.
It's not too bad.
Most of the time, people don't bruise. Contraindications for treatment are people who are on like blood thinners, who are immunocompromised. You really shouldn't be getting injectables if you're immunocompromised, anyways.
No.
And also if you have any other like autoimmune or neurological disorders.
And antibiotics, right? You can't get because it'll kill off the
wouldn't-
effect.
Yeah, I wouldn't. I always finish your treatment of antibiotics before you're getting your injectables.
Okay.
Yeah.
Yeah, that's fair. And alcohol.
Alcohol.
I think it's for the bruising more than anything.
Yes.
Yeah. Okay.
The blood thinners and the alcohol is really mainly for bruising because
Okay.
some people get really upset if they get a bruise, and then you can't cover the area for 6 hours. Very minimally have I seen people bruise. I actually even treat people who are on blood thinners, not just aspirin either, like stronger blood thinners
Yeah.
for like heart conditions and stuff like that. And I just tell them, you know what, you're more likely going to bruise than not, and they're okay with it. They
Yeah.
understand. They're like, well, I bruise easily anyways because I'm on blood thinners.
Exactly.
And then when they don't bleed or bruise, I'm like, oh great, you're actually not bruising. They're like, that's fantastic. So you
Fantastic.
kind of just tell them to expect it.
Yeah.
And then I think with alcohol, they really tell you not to because again, bleeding and bruising, but you're really more at risk risk if you're like an alcoholic, like you're
Right.
always, then your blood's perpetually thin.
Yes. Yeah.
But again, I just warn them, then you're probably going to bruise, and
Yeah.
your area might be a little bit more sensitive. You might be,
More inflammation.
more inflammation,
Yeah.
more painful
Yeah.
at the
Okay.
site of injection.
Okay.
But to put into perspective, the needle I'm using is an insulin needle. It's a very tiny, it's 30 gauge needle.
Jesus. Yeah. It's
Yeah.
small. Yeah.
Yeah.
Not like the filler one.
No, not like the filler one. The filler one's a little bit bigger, but it's
Oh,
not
yeah.
even like that much bigger. It's like, I think it's like 27 or 20.
It's not that. The number's not that. But when you see it, you're like, oh my god.
Yeah, in comparison.
In
to getting
comparison,
neuromodulators,
yeah.
yes.
So fillers, post-care, contraindications.
Yeah.
Yes.
So fillers, because again, you're augmenting the face, it's
Yeah.
hyaluronic acid. The nice thing about hyaluronic acid treatment is that you're actually seeing the effects right away.
That's true.
It's not something you're like, once I augment you, you are seeing the effects right away. However, it's still a 2-week downtime because at the point of injection, there's going to be discomfort, redness, and swelling, and more likely than not, you're going to actually have bruising.
Yeah.
You're more likely to have bruising with fillers than you are with neuromodulators.
Okay.
The needle is just bigger. Also, it's an acid.
Right.
Right, it's
Yeah.
actually an acid. I don't think a lot of products don't have lidocaine in them nowadays. So if you have an allergy to lidocaine,
Yes.
you cannot get fillers.
Because they all come with
They all come with now, unless there is still one more product. I know
available.
there was a product that was available that didn't have lidocaine in it. But let me tell you, I did use that product myself.
On yourself.
On myself, because it was one of those things where I'm like, oh, my product is expiring soon.
Let's try.
I may as well just use it on myself.
Yeah.
Like, how am I supposed to sell something I've never tried
That's
myself?
true. Yeah.
So I tried it, and let me tell you, it's straight fire. It's
It must
injecting
burn.
fire
Yeah.
into your, and I did it. I don't have them anymore because I had it like 3 years ago.
Oh,
but
God, yeah.
I had them injected into my lips. So just having like fire injected into your lips without lidocaine, you forget that it's HA, hyaluronic acid.
Acid.
You
yeah.
forget it until it burns. So a lot of these products that most of them have lidocaine in them nowadays because it just doesn't make
just
sense
works
to,
better.
It just doesn't make sense to put yourself through that.
Yeah.
It's more comfortable for the client themselves. It's more marketable
True.
as well.
True. Yeah.
However, you still will have a little. I find it's more painful to get filler treatments than it is to get neuromodulator treatments.
That's what I've heard. Yeah.
At the point of injection, you do feel the burning sensation right when the filler is injected. Then right when the product gets into the skin, it's like the poke,
Yep.
the painful poke, and then a bit of that burning, and then it starts to go numb.
Oh,
because the
'cause the
lidocaine,
lidocaine is there.
embedded in the
Right.
product itself.
Okay. Wow.
Yeah.
If someone were to have a reaction to lidocaine while you're doing it,